Good morning. My name is Megan Clanahan. I am the co-owner of Houston Moms, and it's a new year. And we are so excited to bring you some more health topic and information from our friends and partners at UTMB Health. Y'all have seen us here before talking about all sorts of important topics. Well, January, not only is it a new year, but it is also cervical cancer awareness month. And so we thought it would be timely to bring you some really important information about cervical cancer. It's may have some tough points but we need to talk about it. And we need to be aware of the symptoms, the signs, and all of that. And so to do so, we brought in an expert from UTMB Health. Dr. Carpe Solis is here to chat with us. She's with the Brazoria County portion down at UTMB Health, and she's an OBGYN. Good morning. Thank you so much for being with us.
Good morning. Thank you for having me.
Yeah, would you mind just sharing a little bit about you, your practice and passions?
Yeah, so I'm originally from New York. I've been living in Texas for about 17 years. I joined UTMB last year with that privilege. I practice OB and GYN general practice. Married with 3 children. I have one who's a sophomore at UTMB. At UT Austin, and then I have a freshman and then a junior high student.
Oh, wow. Okay. So you have also Hookem. It's been a good sports year for UT. So but you're a
Yeah.
mom, so and you're in practice and you know what it's like to be a busy mom for sure. And so obviously we're talking to mostly moms here and really just wanting to give them great information. So what is cervical cancer?
So when you have the uterus, the lower part of the uterus is called the cervix, and that's the part that we can see from the vaginal area. And cervical cancer is cancer in that lower part of the cervix, and it's related to the human papilloma virus. When we look at cervical cancer, over 97%, we have HPV that's isolated, and so that's the cause of cervical cancer.
Okay. And everything that I've heard about cervical cancer, is it's always such a silent disease. Um, and presents very quietly. So are there signs and symptoms that we should be watching for?
So the challenge is we get HPV exposure probably those first few years we're sexually active. And so there are no signs and symptoms. By the time people come to me, generally the condition is advanced. And so when they do have that, I have them have abnormal bleeding or they can have pelvic pain.
Okay. And with cervical cancer, are there specific screenings that we can do to find out if we have it or if we're carrying it or carrying HPV?
So it's the pap smear. The pap smear was invented in the 1950s. And then by the mid 1980s, we'd really decreased the rate of cervical cancer by 70%. So coming in for an annual wellness exam, we will take your history, look at your risk factors, and then usually by 21, we start collecting pap smears.
Okay, so I know when I go to my OB or my general practitioner now, but um they are only saying for me like every 3 years I need a pap smear. What is the recommended right now for, does it depend on history? What does that look like from a pap smear recommendation?
So it depends on age. So between the ages of 21 and 29, we get initial pap smear. And if the pap smear is normal, then we space it out every 3. By 30, we start doing something called HPV co-testing with the pap. So we do a pap with HPV testing. If they're both negative, then someone's considered very low risk for cervical cancer, and they can go up to 5 years between pap smears. But if
Okay.
someone has a history of abnormality, any precancerous changes, then obviously we'll do that a little bit closer together.
Okay, that makes sense. So I guess my 3 years sounds about right.
Yes.
That's where we are. Um, so let's say we are diagnosed with cervical cancer. What does it look like now when you're diagnosed? What are treatments available? And what's the path for a mom or a parent who's been diagnosed with that?
So the first thing you're going to do is you're probably going to get a call that your pap smear is abnormal. And
Mhm.
so for us to determine if someone, we can't really say someone has cervical cancer just based on a pap smear because it's a screener. So then what we do is something called a colposcopy, which is really the way we diagnose if someone has cervical cancer. And what we do is it's like a speculum exam. We use a microscope to take a look at the cervix. We put a vinegar stain solution on the cervix, and then we take targeted biopsies on areas that are abnormal. And sometimes what we have is we have patients who have precancerous changes and then cancer. So in the US, we've been able to really decrease the rates of cervical cancer because if we have someone who has precancerous changes, we are able to do treatments for that. So one of the most common ones is something called the conization of the cervix, where we take a cone-shaped out part of the cervix to take out these precancerous changes so that they don't turn into cancer. But if the conization shows that, the lesions extend beyond what we remove, or there's cancer, and then the first option is if it's caught early, then you can do surgical treatment. So with a hysterectomy, we would send someone to a GYN oncologist, a GYN cancer specialist to go ahead and have the hysterectomy. Now, the challenge is when we have advanced disease. So in advanced disease, generally we're looking at radiation and chemotherapy.
Okay, so there are options, and I think it's so encouraging that how dramatic the levels have come down, and thanks to the screening and all of that. Um, so then, of course, if we've reduced it because of screening, how can we prevent this? What are some ways that we can talk about preventing cervical cancer? Is that out there?
Yes. So since we know that cervical cancer is caused by the human papillomavirus, there was a vaccine that was created and that's been in circulation for some time now, and that we recommend patients getting, and that can 99% of the time will prevent cervical cancer.
Okay, say that again. So 99% of the time that
It'll prevent advanced or cervical cancer disease. And obviously, the best time though to get this HPV vaccine is before you've become sexually active.
okay. So what is the recommended? Because when we go to the pediatrician, I have two 13-year-olds, and they are, obviously they're saying, get the HPV. What is the recommendation from y'all's end?
So the ideal time is between the ages of 11 and 12, but you can start as early as 9 and you can go all the way up to age 45, right? So if we do it between the ages of like 9 and 14, then they only need 2 vaccines. If we do it age 15 or higher, then they'll get a series of 3 vaccines.
Okay. Is there any like concerns people should have over the HPV vaccine?
Um, the vaccine has been around a while, and so from that, I mean, usually you'll have surgical, little site irritation or those kinds of things. But CDC.gov has a area and site that you can look on that says the safety of HPV. So they wanted to look at details for it. Not only do we recommend the girls get vaccinated, but we also recommend the boys because as we look at cervical cancer, we're also looking at oral genital cancers, which are on the rise and that are also HPV related. I know I vaccinated my sons in future to protect their wives.
So that's so interesting you should say that because my twins are boy girl. So I've
Oh,
always wondered why they said, for my son to get it as well. I never knew the reason. So thank you for sharing that. That is really important. So I know one thing that we love about UTMB Health is that if somebody were to come to you and they have an abnormal pap, what is the process of how does your network work to get them into the right, the right area? If they need a hysterectomy. Can you kind of walk through that process with this?
yes. So if they see me or one of the nurse practitioners and they would do the initial screening pap smear, we would then proceed with a colposcopy in the office. And
Mhm.
depending on what that shows, we would still be able to do the conization. Sometimes that's done in the office, sometimes that's up in the operating room. And depending on what the results are, then we have a team of GYN oncologists that we can refer to if they need surgical intervention for a hysterectomy or oncologists if they need radiation and chemotherapy.
Perfect. No, we love that about you guys, that you're kind of the first stop, and then you have the experts to in the different fields to field out to. So that is incredible. So I know we kind of went through all of that pretty rapid fire, but we wanted to be able to give people some important information about cervical cancer. Anything that we missed that you would love to share with our audience?
So in the United States, we have this privilege of having the pap smears available and the HPV vaccine. My mother personally had cervical cancer. And so when you look at like Central and South America, and we have these populations that are coming to the US, they don't have these things available. When I see cervical cancer, most of the time it's for people who haven't seen a provider in some time. The other thing is that smoking does increase the risks. So avoiding tobacco products is helpful.
Okay, so I think that should be a resolution for the new year as you're kind of making your goals. Um, Moms are kind of the first to neglect our health. Like we'll make, all the appointments for our kids to make sure that they're staying healthy, but then we're not making time for those pap smears for ourselves. And I can attest, I've had many, I feel like it feels like many. By the time you're 44, it feels like a lot, but it's super painless and it's quick and it's easy. And so if you're out there and you haven't gotten a pap in a while, maybe we should go ahead and do that. Thank you so much for being with us today and sharing information about this very important topic for Cervical Cancer Awareness Month for January. So next month, we will be back with another informative health video. And we want to hear from you too. So if there's a topic that we haven't covered in a while or haven't covered before that you want to know more about, drop it in the comments below. Also, we are going to put in links for this whole area of UTMB health for the OBGYN department and oncology, so that if you need to go ahead and schedule that pap smear, then we can get you connected right away. So stay healthy, Houston. Enjoy this gorgeous rainy weather, and we will see you back next month. Take care.